Hey there, I need to show you an exercise that I saw online this morning that I do not want you to do. Hey there, it's Marian, and I am happy to bring to you today something a little different. I am taking a common exercise because it's for a common problem. Breast cancer patients after surgery generally have really tight pectoral muscles. There are a lot of pec stretching exercises out there, and there's one in particular that seems to be around for breast cancer patients right after surgery. Now, it's not with a bad intention that these exercises are online. It's with the best of intentions of helping breast cancer patients. But how they're doing the exercise is putting you at risk. I don't want you to be at risk. I want you to have the knowledge to know exactly what's going on with each exercise. And I want you to feel confident about how you're doing your exercises so you can reach your goals and feel empowered. I don't want you to risk having injuries in any other parts of your body, and I don't want those shoulders and the neck or the chest or the upper back to suffer from bad positioning while you're trying to get better. So let's educate, let's grab some knowledge, and let's move forward. So I want to point out this exercise that I saw online, and I've done a front view as well as a side view for you. Bringing this back to the beginning to show you exactly what you need to have before doing this exercise. If you look here, I've got, in order to reach my hands on my neck, and not even in the proper position, but we'll get there in a minute, is I've got 90 degrees of shoulder flexion. So if you can't get your arm straight out from your shoulder in front, the flexion, which is a foundational move, then you can't do this exercise yet. Even if it's listed in your pamphlet, you need to work on the foundations first. So we need to have 90 degrees of flexion, and as we go through, we can see that that flexion changes to abduction, another foundational move. And as you can see here, this is greater than 90 degrees. So if you have frozen shoulder, you cannot get in this position. If you haven't worked on your foundational moves right after surgery, this exercise is not for you. Now, what I want to point out as well from a safety standpoint is things that you should have been working on, which is for wrist movement as well as neck movement, is we want to make sure we have a nice neutral neck posture, which you can see that I'm demonstrating here. I don't have. I've moved my neck to try and compensate for where I have to put my hands. Because my shoulders cannot get to the position that I need for this exercise, and this is what I saw demonstrated on the YouTube video, I have to jet my chin out and put a strain on the back of my neck in order to get to this position. The other thing I'm doing is I'm extending through my wrists as well as through my fingers in order to get to this posture. So if lymphedema is a risk factor or you have lymphedema, you are putting a stress and a strain through the joints in your fingers and your wrists, and they're stabilizing in that position, which means there's no flow. You're using the muscles to hold on. We want to stretch at the beginning, not strengthen. And now you're using your fingers and your hands to hold into place and to decrease that flow. So this would definitely be a risk factor. From the side view, you can see that I've lost some of that curve in my back. I'm leaning forward. You can see the scapula coming out here. So I'm not stabilized in my core very well, and I'm arching and trying to reach forward with my shoulders, with my upper back, to try and get to that position of stretching out my chest. So I'm not actually stretching out the chest as much as I think because I'm arching my back. So another thing that you need before this exercise is good core stability. I'd rather see you do this against a wall, because then you can make sure your head and your mid-back and your tush are against the wall, and any movement you have is through the shoulder joint, because that's what you want to do to stretch out the pecs. You can also see here the chin jetted up, and we're really putting some things at risk here in trying to do this exercise. So as we saw in that exercise, there are benefits to stretching out the pecs, but not in that way. You are putting other parts of your body at risk. And that's why my whole philosophy is moving well. I want you to stretch the pecs. I really do. But I don't want you to do it that way. I don't want you to do it at the risk of your elbows, at the risk of your wrists, at the risk of your neck, at the risk of your low back. We are getting better. We are building our confidence in our exercise. And the whole goal is to have a decrease in your symptoms and an increase in your function. That's the goal. I want you to feel awesome. Have a great day.